is the CEEP Network webinar, a national webinar about the COVID-19 crisis outbreak and the church's response to it. We're grateful to Joe Swimmer for his organizing it today and to all of you for joining. We're going to start today with an invocation from Nathan Kirkpatrick, who is the director of the Alban Institute at Duke. Nathan, please pray with us.
The Lord be with you.
And also with you.
Let us pray. Almighty God, in whom we hope and trust, in a time unlike any that most of us have ever known, when things we have relied upon are being called into question, when things that have comforted us now feel distant, when worry walks with us. Give to us, we pray, the grace, comfort, and strength of your Spirit as we discern how to be the body of Christ for this age. In this virtual time together, may we find support in one another and receive wisdom from one another. And above all, may we be renewed by the promise of Jesus Christ that we are never alone, but that he is with us, the one who lives and reigns with you in the Holy Spirit, one God, forever and ever. Amen.
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 Thanks, Patrick.
Thank you, Nathan. So I'm Matt Hyde. I'm rector of Church of the Heavenly Rest in New York City. What we're going to do today is introduce each of our panelists. We're glad to have a group whom Joe Swimmer has gathered from across the country. We'll talk to each of them. We'll talk a little bit together, and then you'll be able to email your questions, send your questions in, and we'll take some questions from the folks. As of right now, we have about 117 people from across the country joining, so thank you for joining. So we'll start with our introductions of our panelists. First, Dr. Eleanor Bergquist, who is the former epidemiology manager for the St. Louis Department of Public Health and current adjunct faculty member at the Washington University in St. Louis. Dr. Bergquist teaches a class at WashU entitled Introduction to Local Public Health Practice, Communicable Disease Control, and Emergency Preparedness. Welcome, Ellie. The Reverend Doyt Conn is rector of Epiphany Episcopal Church in Seattle, Washington, which has been in so many ways the epicenter of this public health emergency in the United States. Welcome, Doyt. The Reverend Dr. Russell Levinson, rector of St. Martin's Episcopal Church in Houston, which is the largest Episcopal church in the country. And Russ represented so many of us as he said goodbye to George and Barbara Bush last year, a wonderful, very public demonstration of the power of our liturgy and our pastoral care. And the Reverend Dr. Noel York Simmons, rector of Historic Christ Church in Alexandria, whose diocese just suspended all worship services for the next 2 weeks and made the decision to suspend all church activities. Welcome, Noel. So we're going to begin with Dr. Bergquist. Dr. Bergquist, Ellie, what do you wish that every clergy, every leader in the congregations knew about this crisis, about the COVID-19 outbreak?
I think I would like you to know something you already know, which is that it will take a lot of stamina and a lot of mental health strength and preparedness to see your congregations through it. A lot of things are talked about in the physical sphere, whether it's social distancing, vaccines, treatments, etc. But in many, many ways, the ability to beat the virus will have to be a mental game and potentially a spiritual game, because it's going to be so much longer than anybody thinks. It's going to be longer than 2 weeks. It's going to be longer than 3 weeks, maybe more than months. It just depends. Your colleagues who are here with us, they've been doing the social distancing and the shelter in place and the isolation measures for weeks now. And here in Missouri, we're just getting started. So we're thinking about it in terms of, oh, next week or the week after, our school's canceled until April. Well, things have been canceled elsewhere, and they're looking at coming into their third and fourth weeks now, just now, when some of us are just beginning. So I would also say, as you're doing now, look to your peers who've been doing it for a little while and see what strategies they've been implementing to keep people's spirits up and just keep going. But from a viral perspective, knowing that it is person to person, which I'm sure everybody's discussed a lot. You know, you've probably all suspended the peace. You've probably all suspended in-person worship. You've probably suspended deliveries and different things. I'm sure other people are going to talk about that later. But if there's something specific, I can talk about that too.
Well, I would like you to talk about, you know, so much that we're not doing right now, or not able to do right now. What do you see as the role of faith communities in this kind of public health crisis?
I see the role of faith communities as, again, supporting people in ways that they haven't really been doing before. So much of the faith community has been about coming together. And now the challenge is to figure out how to keep that connectedness and keep that feeling of coming together and being together without physically coming together. So just reaching out, in thinking about this call and thinking about you all and things you could do, I was thinking about, I deliver like Easter lilies and poinsettias, to individuals who are in their houses for our church, at those times. So maybe tapping the parishioners that have the resources or have the time to be in some sort of phone bank where you, instead of sending someone in person to deliver an Easter lily, if they have 20 minutes to call an individual who's at risk in whatever way, maybe they live alone, maybe they're elderly, maybe they're medically at risk. I'm sure you all know who your your at-risk parishioners are, and tapping the people that feel a little bit more secure for, to call people for a 20-minute conversation. How are you doing? This is your virtual Easter lily. We can't connect with you in person or with a plant, but I can call people or write notes and send parishioners or people out to slide it under people's doors, something that wouldn't have that in-person contact, would still feel that connection.
So many of us in parish ministry are learning about how to access public health resources, how to access information. There's so much out there. What advice do you have for parish leaders about how to find well-grounded medical and public health information right now?
Oh, that's really tough. Obviously the CDC has good information, but it's really hard for any government agency to keep up with the pace of what has become sort of the global media machine. Government just doesn't run as fast as media does in this day and age.
Right.
So I would say find a trustworthy media source and maybe promote that. It varies from region to region. The other thing is like your local government, a lot of the restrictions and a lot of the regulations will be at the local level. So making sure that you have a handle on who your local officials are, following them on Twitter, figuring out case counts, et cetera. Those will be your most accurate local sources of information. Beyond that, I'm sure you've all seen the Johns Hopkins website. They have a beautiful interactive map where you can track things and find out where things are now. A lot of the universities are doing great research. So I think it's Mount Sinai in New York has a lot of great information coming out of them. In terms of like local health departments, Seattle-King County is the best of the best. So turning to them for anything and everything is always a good idea. So again, looking local.
You've been working in this area for quite a while. What surprised you about this so far?
I could, surprise me is one thing, but I think what has disappointed me so deeply is the testing. I think that that's really scaring me because I think that we don't have a handle on the denominator. Not having a handle on the denominator and not doing the testing that we should have been doing all along for various reasons that we don't need to get into now about what happened in the past, but we're starting to ramp that up and that's great. But what we'll see now is a really big spike in the cases. It's not that they haven't been there all along, but they've been spreading and they haven't been tested. The flip side of that that's good is that we'll start finding more asymptomatic and low-level disease, which means the mortality rate is actually going to go down. Right now, the mortality rate is pretty high because we're only finding really severe cases of disease, We're only testing people who are already symptomatic. And if you're already symptomatic, you're down a path. So there's going to be good and bad with us ramping up the testing. The case count is going to grow exponentially, not literally, as you've seen, but on the good side, we'll be finding a much bigger denominator, so the mortality rate will lower.
Well, so
hopefully.
Step back and describe what denominator means for those of us who are
sure. Sorry.
who are just exploring the field of public health in ways we didn't expect to when we went to seminary.
Yeah,
Talk
I'm
about
sorry.
Denominator, what it means.
So
no, that's great. It's
the
good,
denominator. The denominator is the bottom number in any different rate. You know, when you hear something, when you talk about the mortality rate of 1%, the denominator is the bottom number. So it's out of how many people. So if COVID-19 is killing 1% of the population, that means it's killing 1 out of 100 people. That 100 is the denominator. So, I mean, ultimately the denominator in the US is the US population. And then the denominator for COVID is how many of us get sick out of that and get tested.
And that number you're saying will shrink?
No, the denominator is going to get bigger.
The number of, okay.
But so as the denominator gets bigger, the total number of people tested gets bigger. That means the people that are dying, that number will be the same, but it's out of a bigger number. So that rate, the percentage goes down. That's right.
Well, good. So as folks here know, there were several folks who attended the CEEP conference in Louisville early this year who've now tested positive for COVID-19. For everybody who attended the conference, including a number of us here in the webinar, what should we know?
Oh my gosh, there's so much to know. I mean, the first thing that I think is really interesting that people may or may not know, it's my understanding that the coronavirus has a lipid layer. And so that lipid layer is really vulnerable to soap. Soap in particular breaks it down. So that's why you see a lot of guidance on hand washing and cleaning in a way that you wouldn't necessarily see. Hand sanitizers are great, but really your best defense is the good old-fashioned hand washing with soap. Again, because it's the most effective thing in destroying the virus. So that would be the first thing, is just wash those hands until you don't want to wash them anymore. I mean, it's starting to be warmer climates most places, so that's good. So our hands aren't going to crack, you know, and from the dryness of all the washing, but washing. And then of course, if you feel sick, to seek medical attention immediately. It's my understanding that when COVID goes, it can go fast. So if you think there's anything going on with you, don't be worried, but be knowledgeable and just go see a practitioner. The most important thing is to catch it early and then to look backwards and see who you may have interacted with so that those people can then get a test and see what their status is.
Great, thank you. Dr. Bergquist, Ellie, thank you very much for leading us off. Doyt Conn, Doyt, we've all been following the news from Seattle, from Washington State, and I think as of today, there have been 34 confirmed cases of COVID. Talk about what the mood's like in Seattle and at Epiphany, your congregation.
Yeah, well, you know, I'd say it sort of came on us fast here in Seattle. I would say while there were sort of conversations and rumblings about the coronavirus, it didn't seem to really hit people's radar until about Ash Wednesday and a little bit after, when all of a sudden it moved from just sort of a thing that was someplace else to a thing that was in our midst. So that was a pretty big shift. And then we had the incident at in Kent, or in Kirkland. And that, you know, interestingly enough, even though that was a huge thing, at least on my radar, the radar of folks that are in this congregation, it wasn't wildly talked about. I mean, and so I would say, you know, we have, our policy here at Epiphany has been to just do what we're told to do, right? And we're not leaders in how to respond to this because we're not experts in what this thing is. Right. So anytime the bishop would give us instructions about how to perform worship, or the government, and you're right about King County. I mean, that's where I send everybody, the King County Health Department, for any information they need on this. That's where they go. And so we just do sort of what we're told. And I would say the congregation has a pretty low level of anxiety. And I would say Seattle, maybe for a city, is pretty, at least when I'm not a non-anxious presence in the face of this. Maybe that says something about Seattle. But as we've gone forward and done things, with regards to shifting our services online and other things like that, canceling all of our meetings and whatnot, I haven't gotten any pushback. Just none. There is, this is sort of where we are. What we're calling this is the great timeout. Right, like so everybody's gone into timeout in a sense, and it gives us an opportunity, if you will, to reflect on what it means to be Christian. And I think our identity as a Christian community in a city where we're often apologetic about that, or often seeking to fit into a strong secular culture, is shed a bit in the face of this coronavirus. So I would say the one thing that we're talking about a lot is the bad thing is never the last thing when you're people of the resurrection. Right, our backstop is significantly different when we're a Christian as opposed to just a good neighbor. Because a good neighbor coming up to somebody who has a COVID-19 and says, "Oh, things will be okay," has no evidence as to whether or not that is true or not true. But as Christians, we always know things are going to be okay because we live in the kingdom of God, and the kingdom of God perspective is huge, and it pushes beyond the boundaries of anything that a COVID-19 could do to any of us. And so, to articulate the reality of what it means to be a Christian at this time is exciting, because Christians are the best when the times are worse, right? We have a history of proving that out. And so this is an interesting time for all of our parishioners to sort of sit back and wonder how we're Christians in this city of Seattle. And so the great timeout gives us moments of reflecting on that.
Well, I would love, you said that so powerfully, Doyt. I would love for you to walk us through first how you came to that decision as to what you're going to do and not do, and then how you framed it, communicated it to your congregation, both the pastoral piece, the program piece, and you've articulated something deeply theological about this moment. So how did you decide and how did you communicate it?
Well, I don't know how we decided. I think we're providentially fortunate. I hired a full-time communication guy quite a few months ago. So we were really sort of geared up on Instagram and Twitter and live stream and YouTube and our YouTube channel and to be ready to quickly respond. So we've done a number of things. Of course, we live stream our Sunday service. We put out a PDF so the congregation can follow along. Now we're delivering communion to people's homes. Not to give it to them, but the wafer that they can have on Sunday, as well as the PDF if they don't want to print it off their computer. So we're doing those kinds of things around the Sunday service. But the other thing is we have a daily Bible study. We have a weekly hour-long Bible study. We have a prayer 4 times a day using a Marco Polo app, which we used in the past, but now that's gone up significantly. We just pray out.
Well, so stop 1 second for those of us working. Tell us what the Marco Polo app is.
So Marco Polo is sort of like a FaceTime walkie-talkie. And you can go on the App Store and get Marco Polo. And so 4 times a day is the little hour-by-hour book, and we use that here all the time as our common prayer. It has 4 times a day. And so somebody just comes on and reads it, and you get a little ding that they've read it, and you go on and you read it. And so we're doing that community prayer multiple times a day. We're doing the daily Bible study. We do a daily organ recital for the congregation. We're moving towards a daily reading of the C.S. Lewis books for kids and families. And so we also do, we're matching communities. So we're saying, okay, you 12 people live within 8 square blocks of each other. You should know each other. And we're doing a lot of one-on-one. I think we've done 100 one-on-one connections. This is somebody to check in on every single day. So all of that is happening as well.
Well, so let me, this is fascinating because you've talked about the timeout, and it seems like you found ways to be even more connected to your people in different ways than you were before. Tell me how long you've been at this, and over the last, how have you developed this timeline-wise, and If people are just starting down the road that you've gone down, what would you tell them to think about first?
I would tell them to definitely think about how they communicate with their congregation. How they give short messages of hope, theological framework in which they can think about what's going on in the world around them. I think those are, and the other thing, I think about Epiphany as a first responder. We are a first responder for the human soul. And so what we do is really, really critical to the health and wholeness and holiness of individuals and of communities. And so we got, at Epiphany, we're working more, right? And we're working in new ways. Of course, we're doing all the Zoom stuff with all of our meetings and all of our business meetings and all that. It happens on Zoom. But we're also calling folks, right? We're reaching out to folks. To give you an example, on March 8th, which is, I would say March 8th and maybe 7th or 6th, or when we really started to gear up, to be perfectly honest, that's only where we are, right? So all of the stuff that I've described, most of it has happened since March 8th. And I preached a sermon on the coronavirus. We had 65 people tune in to our Sunday service. On March 15th, we had 898 people tune in to our Sunday service when I preached on the stock market. So you can see that massive shift of people sort of knowing what's going on, and they were coming to church on the 8th, and our attendance was down about a third. And then on the 15th, nobody was in church. And we had 800 and almost 900 people view our service online. So those are a couple of things. It's interesting. Ellie was talking about going to the hospital. Right now in Seattle, if you have a fever and you have a cough and you call your doctor, the doctor will say, stay home, don't come in. And the reason is there's no tests here. So our clinics are virtually empty. We do have respiratory clinics that are developing. We do have hospitals that are pretty full, but there is still a huge lack of knowing who has the COVID virus and who doesn't. Our county president, Dow Constantine, I don't know what his title is, executive, said you can assume that everybody you meet has been exposed to the COVID virus, 100%. So that's the reality that we're living. And so there's no, like, if you come down with COVID-19, you don't have to track back everybody you saw, because everybody's been exposed.
Right.
So that's a little bit different out here.
Well, Doyt, thank you for this. I want to come back and we'll ask everyone a couple of questions based on some of the things you said. I want to turn to Noel York Simmons. Noel, the Diocese of Virginia canceled all public worship for the next couple of weeks. How do people react to that? And tell me what you've done. Same question we asked Doyt. What have you done? What's been the process of decision making? How have people responded?
Yeah, so curiously, when you said that in the introduction, and we all know this is changing every day, the scenarios and sort of how we're dealing and what the new information is seems to be shifting and changing every day. So yeah, the Bishop Goff called for closure of all worship last Wednesday. She made that call. So this past Sunday morning, we did a live stream on Facebook, and we were planning on doing a similar thing this coming Sunday, and now it's looking like we're going to follow along with what Washington D.C. has done and close for much longer. So we are liturgically we're shifting the game a little bit from the old it's no longer a sprint. It's no longer how do we hold on and cobble this together for a couple of weeks and watch out for people for just a short period of time. It's how are we going to be doing this for the long haul? And it's back to what others have said. It's a revisioning of how we do this. It's not just doing what we've always done, but doing it on camera. It's looking at a new way of being church together, having to redefine both liturgically and socially and communally what being church means if we are not physically able to touch each other, if we're not physically able to hand over the body and the blood. It's very essentialized questions, while we're also trying to figure out the right lighting for a live stream. Like it's kind of a new, I mean, I didn't go to seminary for this. So, yeah, we are in the unfortunate position that, wonderful position that we're getting a new organ, but we just ripped out our old organ and took the AV system out with it. So that just happened last month. So we got hit with this, and we're having to learn new ways of doing technology because we don't have a camera installed right now. And while it has brought about a lot of grief and some deep sadness about this thing that we're having to set to the side, this way that we are church together, this way that's very comforting. It's the thing that we lean into when, as Doyt said, when we are pressed, when things are really dark, so many of us lean into church, we lean into liturgy, and we don't have that to lean into. And so there's some grief there. My parish has been phenomenal, amazing. Everybody gets it. Everyone understands. Everyone's learning how to use the new tools. We're seeing great numbers in our online worship things. And then we're getting emails about it afterwards. Thank you so much for doing this. I really appreciated seeing familiar faces. I really appreciated hearing the words. It gave me comfort in this time. So people are okay with that. But I'm also hearing a lot of grief about the fact that we've gotten to this point.
So how do you respond, the pastoral response to that grief and loss that is amidst lots of other loss, I think, that people are experiencing in other parts of their lives?
Well, Matt, I'll be honest, I'm working on my own grief first, while I'm also working on other people's grief too, because I am one of those that leans into the liturgy when I'm, I look forward to Holy Week 51 weeks out of the year. I love it. That's one of the reasons I'm in this profession. And so I'm trying to balance out that revisioning and that new thing while I'm also trying to sort of tend to my own feelings of grief. I haven't, we haven't officially, everyone knows it's coming, but we haven't made the official announcement to the parish yet. So I haven't had a lot of that feedback. I am hearing people, especially people that live alone, are not living with a spouse or a family. I'm hearing a lot of grief over isolation. I was just emailing with a group of people that gets together for Eucharist. A group of my parishioners gets together for Eucharist and lunch every Wednesday. And I emailed them today and said, I missed you all at Eucharist. I missed you all at lunch. How are you? And that grief is, I want to be together. I'm lonely, but thank you for reaching out. And it's a lot of phone calls. It's classic phone calls, emails. Who am I hearing from? Who am I not hearing from? And making sure that someone, be it vestry or pastoral care committee or someone is touching everyone in the parish in some kind of electronic way.
So you described not just doing the same thing online, but re-envisioning, reimagining what church means. We're all learning about this in some way. What have you learned as you started, and what's your advice to other people about kind of the first steps as they're thinking about these same things, seeing the same things?
My primary advice that I have is colleague up, like figure out who else is doing what, and borrow and share ideas. Some of the best stuff that we've gotten. So I'll shout out to Michael Sniffen up on Long Island. He shot in late last week. I'm doing a virtual coffee hour on Zoom on Sunday morning. And I went, that is brilliant. And so we set up a Zoom, and we had like 60 people that came to coffee hour with their little coffee mugs and, and they're at their bed head after having watched this do morning prayer. And I got to see people's faces, and they got to see each other's faces. And it was more important than we realized. But I got that from a colleague. It didn't come organically out of our staff. So that, I mean, it's the sharing of resources, I think, right, of ideas is more important now than ever. That's number one. Past that, I mean, we're building this airplane out of a radio flyer wagon in flight. So like, yeah, it's both exciting and scary.
So how is it for your staff?
My staff is, I love my staff, and I have fallen more and more in love with them every day of this crisis. They're working really hard. Again, like Doyt said, we're not working any less. We're just working on different things. They are creative. It's an incredibly kind of fertile time. We're just planting different seeds. And they're coming in, our director of children's ministries has come up with a whole host of fun things that parents can tap into. We're making huge use of Facebook, because that seems to be a platform that people can access really easily in our congregation. Yeah. So our staff is really hanging in there from their own spaces. We are, the staff has permission to work from home or from the office, whichever is most comfortable. And we have people choosing to do both.
Cool. Thank you, Noelle, very much. Dr. Russ Levinson. Russ, Texas now has a number of cases, growing number of cases. I heard that the rodeo ended because of COVID-19, which is, I know from folks in Houston, a big deal. What's the mood like in Texas, and how is it at St. Martin's?
Yeah, I think we're probably we're hearing the same thing from each of us. I think we're probably all experienced a level of shock. I'm typically rather Pollyannish and optimistic, and so I was hoping this wasn't going to be what it became. But as a good doctor here has shared, there's a lot more for us to know beyond what we're experiencing on a day-to-day level. One of the things I've appreciated, frankly, is, and we're doing this right now, is there's a gift in our polity, and that most all of us have clergy friends around the whole country. And so I've started reaching out to clergy friends. What are you all doing? Just whether it's text or whatever. Our bishop, Andy Doyle, has been very proactive, and being here in one of the kind of medical center hubs, he's been daily engaged with the medical center. So Doyt was saying we aren't experts, and that's true. I will say the correspondence and direction we've gotten from our bishop makes me feel like he has become one. And in fact, initially, frankly, I was pushing back a little bit, and he and I had a very frank conversation. I was getting overly concerned about what it meant to cancel baptisms and what are we going to do about funerals, and then just he put before me more and more evidence about what we've just been hearing, and I had to cry uncle. When we got with my staff, we were kind of in a different place a few weeks ago, and then we kind of all mercifully came to the same place, which was to shut down. We have not given, like Noelle, we have not given a definitive date, and we're kind of telling people it's every 2 weeks we're going to update. We're putting into place the same kinds of things you're hearing now. We've not done virtual Bible study. That will start next week. We're going to have a daily thought from each of our clergy team members. We're reaching out demographically to different groups. I have to say, as everybody else has said, I've been very surprised at the very positive and kind of upbeat response. I mean, social media is not a way that we connect a lot at St. Martin's. It is now, and the response has been rather overwhelming. But just frankly, we're in a place in the country where our economy is driven by the energy market.
Right.
We don't know what that's going to look like.
Yeah.
And so there's a whole level here of that angst. I think there's another level of, our mayor has shut down all the restaurants, all the bars, all the health clubs now are shut down. There's no optional coming together. And I think pretty soon we're going to have an extraordinarily serious economic challenge on our hands, not only to some of the members we serve, but the outreach agencies with which we partner. And so we're already beginning having conversations with them. and we're going to have to look, I think, at creative ways to be supportive. Churches with larger resources and churches with smaller resources, how do we share those a little bit more? How are we more proactive in that? And so those are kinds of things that we're just having discussions about every day. However, I have to say, I really appreciate Doyt's introduction because I just finished the taped message for the parish. And I basically ended by saying, this is Good Friday. We're in a Good Friday, but we're not Good Friday people. We know there's going to be an Easter. We don't know what that Easter looks like. But, the Christian message of hope is something that our people, and I think everybody really is going to be drawn to. The fact that all the tangible things in our culture right now are being stripped away from us, whether it's what we have in the stock market to March Madness to watching Stephen Colbert with an audience at night, whatever it is, those things are going away. And it's a tremendous opportunity to point people to the promises of our faith. It really is.
Well, so would you say more about that, especially about, we've been talking about virus response, but you described something all of us are experiencing, which is the economic fear that people are experiencing, the loss of sometimes of jobs or anticipated future financially, and then the other parts of life. How are you communicating that kind of pastoral care, not for medical, but for everything else in life that's changing?
Yeah. Well, I have to say some very practical things. This has given us an opportunity to reintroduce in a larger way to the parish the old traditional spiritual disciplines. Mm-hmm. And I was watching, I mentioned something to some folks yesterday. I was having a virtual conversation. And I said, I watched this Dr. Fauci, who seems to be ubiquitous. There must be 7 of them because he's on every network and every. But somebody was asking him, okay, we're doing social distancing, we're washing our hands, and what do we do until the test arrives? And he said, well, until the test arrives, we should still be doing those things. And I said, right now we're being faced with a cultural, societal crisis. And what it reminds us is that not just in times like this, but all the time, we should be practicing our spiritual discipline. And so, until the test comes, we continue to engage more. So I've said engage more in prayer, engage more in the study of scripture, reaching out to other people. I used in this video message I said, so we've got COVID-19. I said, why don't make it a goal in the next 19 days to reach out to 19 people? Write 19 people, call 19 people, some way reaching out to 19 people in a very clear way. A friend of mine who said, one of our members of our parish said here, when you're washing your hands, don't sing happy birthday twice. Say the words prayer twice. Yeah. Engage in that spiritual direction, spiritual discipline on a day-to-day basis. But I do think, and I think Ellie has said something important. We all know in a real way that this burden that we're all kind of carrying on an extra level now, and I'm talking about our clergy brothers and sisters, it's going to get heavier. And the need to do what we're doing right now is going to grow. I mean, we're going to need to, we can't kind of reflect this angst we're going to be experiencing back on our parishioners. That doesn't help. But supporting each other one-on-one and in groups and however we do as clergy friends is really going to be important to enable us to be kind of we have to cheerlead one another so we can do that for our parishes.
So y'all have raised a number of things: self-care, the question about outreach or service partners and their needs. I want to reflect back to the whole group. Russ, one last question for you about St. Martin's. You described kind of becoming more comfortable with online activities. So y'all are a big place, but it sounds like you've learned new things. As all of us are learning about online activities, how'd y'all start that path, and what's your advice to people who are trying to take those same steps that you've just taken?
Yeah, I mean, Doyt said a few minutes ago he providentially had an IT person. So we've got somebody who does things that I can't do. He works some incredible magic, and is very works very well with us. I will say, I think this is an important piece, that the communication that we've gotten from our bishop has been really important, because we have some people who are in very remote areas who don't have the kind of resources that those of us in more urban areas have.
Right.
And so that kind of regular communication is really important. So whatever bishops are listening, I think that's crucial. And that's mostly been done through social networking. But we have not live streamed until this past Sunday. We've never done that. We have online, sermons and things like that. But all of that required an ability to kind of step up. Now, the interesting thing, and I guess we're saving some cost right now. I'm very committed to not losing any staff members and cutting back on their salaries. I want to do all that, but we're not printing bulletins, and we're not. There's certain areas that we can shut down on campus for a little bit, and so we're kind of retooling those resources in other places. And one of those for now has become our IT world.
So I want to go back to the full group in parishes and start with what Russ just said. We're in places that have had the capacity to go online sometimes quickly. What's been your conversational relationship with other parishes in your area and diocese that maybe are smaller and have fewer resources this way? Have y'all been able to connect out to places that have not been able to make the turn the way you have? What's been that conversation?
Yes, we have. And our clericasts got together. Our clericasts got together last Monday on Zoom. And I say last Monday, I mean 2 days ago. It's been a really long week. To see our clericus in Alexandria has a variety of sized churches, and to see how we can, again, like you're saying, Russ, kind of lean on each other. I invited churches, a couple of colleagues in the area with smaller churches to come join us for morning prayer on Sunday morning to see if this past Sunday morning, to see if, again, for their parishioners to see faces, to see familiar faces in worship in this really anxious and fear-filled time. At that point, everybody had an iPhone and was able to do it themselves. So it wasn't necessary, but we're figuring out how we can both help some smaller churches meet needs, but also see what resources some of the smaller churches in our area can also help us out with, kind of do a shared resources. Yeah.
Good. Thank you. Doyt, what are you seeing in Seattle?
What I'm seeing, I mean, we really haven't sort of met or talked or encountered smaller churches and what they're going through, but I do see the diocese super active in that, developing liturgies for folks. And a lot of our smaller churches have closed down completely in this time. And we're sort of on a 2-week rotation. So, we'll hear something probably, about the 29th and the beginning of April. We'll probably same thing 2 weeks. So we're sort of going in 2-week increments here in our diocese, which I think is wise, because that can just continue to go out as far as it needs to. So us and the cathedral are the 2 churches that are live streaming, and that has been made known to the diocese. But I haven't really, sadly, had much encounter or way of sort of interacting with almost any other parish. Frankly, it's been sort of full stop, just trying to deal with what we're dealing with here.
Well, let me ask a question that Russ raised about outreach partners, people with whom we're serving the community, social service agencies locally. We're beginning to hear in New York about dramatically increased needs for food. Social isolation is something that folks are concerned about. What are you hearing from partners, and how are you beginning to connect with them at this moment? Noelle, I'll start with you and then go to Russ.
So one of the things that became really important to us, and Ali, I'm sure that this is against protocol and we're trying to find that balance, is that we have the AA and NA and Al-Anon groups that meet in our buildings. They're actually in kind of an otherwise unused part of our building. So we've actually given them permission for as long as they feel comfortable to have access to their meeting space. So that's one, kind of balancing that very real need for social isolation that we're taking seriously, with the fact that we all know for people in recovery, it's these times of fear and stress that are most critical. So we're helping them to make that call when they need to. So that's one piece. We also at Christ Church have had historically, and still do have, a very robust financial ministry for the working poor, for folks that live on the edge, one paycheck away. And we also have a food pantry that meets once a week. As part of a network of food pantries in the city. And at first, a week ago, when we said, all right, no more worship, no more gatherings, we said, but we will keep these two things happening, and we'll modify a little bit as we need to make sure people are waiting several feet apart. And then in the last 48 hours, we've done these massive overhauls of these two programs to ensure that they can continue to meet, because these are the people that we're seeing, again, a different population than AA, but there's still that same critical need. If we're not providing this food, then these are families that don't make it to the end of the week with food in their houses. So we put into place all kinds of, our director of mission and outreach has been an absolute lion in this. She's amazing. And she has been putting in a lot of time ensuring that we are doing as much social distancing as possible. People are packing up food in packages so that they can be handed over or delivered with as little contact as possible. We're finding we set up, instead of face-to-face financial meeting, we set up a hotline. And we've also been pushing the city and winning to get evictions, moratorium on evictions for this sort of next period, so we don't have to worry about people with rent needs. I hope this is happening in your cities too. The utility companies are all stopping cutoffs, and they are suspending late fees. So we can not worry about those people that call, that say, I'm afraid my power is going to be cut off. We can say, you know what, you're good for 2 months. And so we can kind of kick that can down the road a little bit. So there's been a lot of, I've actually been moved and impressed by the work that people are putting in and figuring out how to be repairs of the breach, even when they can't be face to face. It's pretty powerful stuff. There's a lot of seeds of creativity and seeds of grace and seeds of hope that are being planted right now. It's just kind of up to us to tend and water them.
Great. Thank you. Russ, what are y'all doing at St. Martin's?
Yeah, I mean, actually touched on some things that made me think. Otherwise, we do have a huge recovery ministry on campus. We have 22 groups that meet on our campus every week.
Wow.
So I had to immediately meet with a couple of those folks. And of course, they have a really good network themselves.
Yes.
They were very responsive to say, listen, if we have to close up, we can find other places. So I'm staying in touch with them on a regular basis. So that's kind of piece one. Piece two is intentionally reaching out to those in the parish who are lonely, et cetera. But piece three, it's a very we probably all have parishes like it, very proactive with regard to reaching out. So 25% of our budget goes outside the door, and we don't give to anything where we don't have boots on the ground. So a lot of our members involved specifically in pods. So if we're one of the areas that we support as a community kitchen, where we push most of our financial resources around hunger. And so people have, we've already kind of done some work with them initially. I'll throw out a cheer to my wife. She came up with an idea the other day to call everybody on our street, tell them that she was going to the food kitchen, which is right near the church. She would take any donations, which she did. And it was all done kind of like in a monastic community where you put food outside and hands come and take it. And I came home and our foyer was full, and then she packed it up, took it down there and left it to be picked up. Well, we've now encouraged everybody in the church to do that. Everybody in the church to reach out to the people in the street to get food donations and now take it down to CCSC. But I do, again, as Noel points out, I think we're going to have to be more and more proactive with the city. And again, I'll say, I'm concerned about parishes that aren't resource or aren't corporate, where they really depend on the week-to-week support to keep the lights on and to keep their staff together. And so we're kind of trying to have those discussions as well. So it's not just the outreach effort, but the churches that we partner with and want to support that maybe are going to need some pretty serious help as well. But there's no question. I mean, 2 or 3 weeks from now, it will be, if this continues, hunger and homelessness and meeting your bills, those are all going to be very real issues. And I think we're going to be called to be part of the answer rather than part of the problem.
Thank you. Dr. Bergquist, I want to come back to you and just ask you to reflect on what you've heard from the rector's conversations today about their own parishes and their own situations. What's your sense, based on your public health background, of what's happening and what opportunities there might be for parishes at this moment?
Sorry, I was muted. Well, I think I've heard a ton of amazing strategies. I mean, I think all the people that I've heard from, you guys are killing it. So it's amazing everything that you're doing. And I'm going to take several of the strategies just for myself personally. I'm going to challenge my children to write a letter every day to one of their friends. I think it'll unfortunately be longer than maybe 19 days. For them to reach out. But I think that all of these different strategies are fantastic. And I saw in the comments that somebody wanted one person talking to slow down so they could write them down. So I would encourage a write-up of these things. I mean, as Noel said, not reinventing the wheel and relying on the good ideas of others seems like a fantastic idea. And I think that all of you have really taken the message to heart of protection, and of course getting the idea that it's a long game and it's a mental game in as much as it's a physical game, and wiping down the pews and wiping down the hymnals and all that different stuff, that in addition to that, and more importantly, it's a challenge and an opportunity, not only for your staff, but also I love that you're bringing that challenge to the people, to the people that feel secure enough that you're bringing the challenges to them to think about how they can reach out, how they can incorporate faith into their life in a different way, in a new way. And I think that's a really positive way to do it.
Thank you. I'm going to ask questions come in about something important in terms of staff, and I want to ask that question. Then we're actually closed today on the question that Ellie started off with, which is about emotional and I think spiritual care. So I'll ask everybody, including Ellie, to reflect on self-care before we close. But the important staff question is, how are you handling paying contract employees during this time? Russ mentioned wanting to make sure we keep our staffs together, which I know all of us are value very highly. But the person asked about flower arrangers, paid choir, childcare, part-time folks or contract people. So how are you handling that at this moment? Doyt, start with you.
Well, yeah, currently we're paying all of our section leads in our choir because they're really getting hit, right? Their other singing gigs have just gone entirely away. So while we don't use all of them in our the live stream services, we're still paying them all. We're not currently paying our childcare employees, and I think that ultimately that's my call, but that's been the call made by the head of Christian Ed, and I think their circumstances are such that's working for them. And then of course our staff continues to be paid. And then the other thing, with regards, we're finding the homeless population in Seattle, which is pretty significant, is very anxious because they don't have the same sort of information and so we're really ramping up our capacity to care for them and feed them, which is a huge focus of our attention. But yeah, we're still paying, and we're fortunate that we can continue to pay her.
Good, thank you. Russ, how are y'all handling this?
Yeah, right now everybody continues to get paid, and so that's the hope. I will say we've shifted around very practically. We've shifted around some payables that we can. There are a lot of things that we pay that we probably pay too soon on. Maybe not too soon, but we can put off a little bit more to make sure that we've got the security. So at this point, we're keeping everybody paid as they would be. But I will say we're finding the same challenge Doyt is, because a lot of our singers are singing in the community. I would say about a quarter of our singers are paid, and we're trying to keep them bolstered up. But definitely our sexton crew and housekeeping crew and those kinds of folks. Yeah.
Good. Thank you. Noelle?
Same. We've kind of put out word that we're doing the best we can to pay everyone. That it's not that many people, but it's enough that we don't want to lose our childcare workers. We don't want to lose our paid singers. And that's a piece of it. And then we're also finding ways, I was saying right before we came in on the call that we're finding ways to put our sexton staff to good use. I mean, if they're happy to be there, they're happy to, I mean, they say to me at least that they're happy to be there and have something to do, but they're cleaning parts of the building and sorting things in ways they can't do when there's people around. So yeah, and then we're putting some of our paid staff singers to work, making recordings that we can then fold into some of our online worship stuff. So, but yeah, we're committed to paying everyone for as long as we can.
Right. Thank you all. So closing, we've got 4 minutes left. And so close where Ellie started us about care for the caregivers. I'm trying to think, I think it was Doyt who said that churches are first responders for the soul, which is a remarkable and very true sentiment. So just one moment from each of you about how you're caring for yourself, how you're encouraging your staff to care for themselves. And start, Noelle, with you, we'll go back through, and end with Ellie.
I'm actually maintaining a lot of the self-care practices that I already had, most of which didn't require a whole lot of other human contact. I'm a runner, and I'm still getting up maybe a little later than I did before, since I don't have to hustle kids out the door, but I'm getting up early, I'm going running, I'm kind of working through things that I need to work through in my head on my early morning runs. And then I'm also maintaining I've texted more in the last 2 weeks than I have texted in my entire life, but I'm maintaining contact with a lot of my my colleagues, people that I love, that I know are in the same boat, that I know will understand when I say I am gutted by losing Easter, that they can go, yeah, me too, rather than other good friends that I love. When I say that, they go, yeah, I mean, it's church. So maintaining contact with people I love, maintaining contact with people that understand me, and then running a lot. Yeah.
Cool. Thank you, Noelle. Russ, how are you handling this?
Quickly, I'm probably like Noelle, haven't changed much. The problem is I go to the gym most every day, and my gym just closed today. So, but that's after my morning prayers, my morning kind of personal study. And so I read the paper every day. It draws my prayers outside of my own personal needs. So all that time stays in place. I'm going to have to do my workout in a different way than I normally have. And I'm encouraging my staff to do the same. I'm encouraging to take this time, and I've said it in some ways, this is a gift that we're being asked to pause. As Doyt maybe said, it's a time out that can be spent in a good way. I will say, a new spiritual discipline, I am limiting my news intake to about 30 minutes a day. So I'm not watching the news every time I walk in the door. And in fact, I'm finding comedies to watch that I'm not completely weighed down by this. But that's why I think the spiritual disciplines are so important. You practice them all the time, and they shape who you are for the long haul when things are easy and during times like this. So not a lot has changed, but I'm encouraging the members to kind of pick that up, and my staff as well.
Good. Thank you, Russ. Doyt?
Yeah, I would say, ditto. My spiritual life, my spiritual practices and exercises continue in their regular rhythm. Daily prayer. I'm sleeping maybe a little bit more, and I'm working hard. And I think it's okay to work hard when times are hard, right? I think that's an important thing to sort of step up and say, you know what, maybe some of the luxuries I had before I'm going to put on the shelf, because we're in a particular moment in time. And I think the Holy Spirit always calls us never to miss a moment of transformation. So where before in the city of Seattle, people would say Christianity is maybe just a nice to have, I think now we can articulate why it is a need to have. And so I'm spending more and more time thinking about how I craft my message in editorials or in writings to the congregation or in what I speak online every single day or what I put in my sermons, to really say this is a shift, and it's a seismic shift. For us as Christians, we will never go back to how we were. That will never happen. So the question is, where do we go and why? So I think the great time out is an opportunity to think about how we re-engage as church, bricks and mortar church, when we come back together.
Good. Thank you. And Ellie, I'll give you the last word before we close. Anything you had to reflect on in terms of advice for all of us for self-care? You began us down that road.
My only thing, my life has changed a ton in the past 2 or 3 years. It keeps changing, like big seismic shifts. Today is my first day working at home with my 4 children also at home. They are 10 and under. There are 4. So I know. But I feel really excited about it. I'm going to learn to bake bread, something I've always wanted to do. But I think my overarching theory for this is the same as my overarching theory for my past few years, which is change is a muscle. Just like anything else, the more you use it, the stronger it grows. And so I'm going to use this as an opportunity to see all the things I can change and I want to change instead of the things that I have to change.
Thank you. That's a wonderful way to close. I want to say thank you to Ellie, to Doyt, to Russ, and to Noelle for what for me was a really moving and inspirational conversation. Thanks to Joe Swimmer for his leadership and the leadership of the CEEP Network and helping us find this new path together. Thanks to Nathan Kirkpatrick, who always helps, I think, our whole church to think strategically about whatever moment we find ourselves in. CEEP Network will continue to provide resources for the whole church as we go forward. I know that Joe's working on a webinar for stewardship for communications. We said at the beginning, this is a moment-to-moment experience for all of us in parish life as it is for everyone in our country. And so CEEP will continue to be present, and we, at least as a parish, want and need that connection and those resources. Thanks to everyone who's joined today. May God bless you in your ministry wherever you are, and may God continue to bless our whole church. Thank you, and we'll see you again soon.
Thank you.
Thank you.